There we go. And we're going to do a little bit of a review from our last one about the immune system. We have both the innate and the acquired. The innate immune response is during that first 72 hours. In this case, with COVID enters the body. This is, let me get a corner option here. This is to represent your skin. And as a virus comes through, we have T cells. T cells are part of white blood cells, and they attack basically anything that is perceived as a foreign substance. In this case, virus. It can be dust, it could be bacteria, it could be molds, it could be just about anything. So this goes on. It's non-specific. The way I explained the last time was you go in a room, you have a bunch of kids, and they all have Nerf guns, and the lights are off. And you're walking in, all of a sudden someone turns on the light and the kids get out of their hiding places and pummel you with all the little Nerf guns, the Nerf balls and darts and everything. So that's kind of what goes on here. And many times this will take care of it. Now, after 72 hours, it goes into the more specific immune response. And this is where we have the B type cells. The B cells or the beta cells. They signal the other white blood cells that come over and work at invading this virus. And this is also where the immunity is developed. So this can go on for quite some period of time. And this is also where sometimes a cytokine storm can kick in. We'll talk a little bit more about that later. So COVID-19 symptoms. The common ones that you hear about: dry cough, fever, chills, and difficult breathing. Okay. Now, it seems like every other day we have new symptoms showing up in the literature. Some of them, more or less common ones, are loss of smell and taste, diarrhea, nausea. Malaise is that general ill feeling of health. It's when you are basically just feel like you want to be in bed sleeping. You might have pain in your joints. It's a wide variety of symptoms. Disorientation. This is one that has been showing up more. Exhaustion and headaches. And there's probably 15 others, but these are more of the common, less common ones, if you will. Okay, now for higher risk, this is pretty much around the world. Males have almost twice as high a risk of dying. There's some of the reasons that they're saying right now is that, especially in China and in Italy, that men are heavier smokers. In China, I think only 2% of the women smoke, but over 50% of the men do. And there's a high male population in Italy that has male smokers as well. It'll be a long time, probably years, before we have a real definitive reason why some of these numbers are high. But the stats are showing males almost twice as high. Pre-existing health conditions. Cardiovascular disease is the primary one. Diabetes, chronic respiratory disease, hypertension, cancer, and then the deaths with no pre-existing conditions is about less than 1%. So people that are pretty healthy really don't have too much to be concerned about, especially, or even if you're in the older age group. If we look at the general population, if you look at from age 0 up to about age 49, there's pretty much no deaths. Okay, and then we move into the 50 to 59 group, and that starts increasing, and we get up to 80 and above, and now we're getting up to almost 15%, which is somewhat to be expected. If we look at the flu, the yearly flu, a lot of times we have similar numbers, except the kids, the younger group, is also addressed in the common seasonal flu. So age is important. Again, prior to age 49, or age 50, if we want to break it off in that point, they have very, very little to be concerned about. This is why some of the countries are actually doing the herd immunity. They're not keeping people away from one another. And it'll be interesting to see what happens when they analyze the data afterwards. But the older we are in the United States here, especially, the better it is to stay away from one another. Now, if we look at the blood type, this is interesting. A blood type has a higher risk. O blood type being the lowest risk. We could go into a lot of detail on this, and it has to do with the gene. What happens is that the area that the ACE2 protein is mediated by a very close area that dictates the blood type on the gene. So really quite interesting. The ARDS stands for acute respiratory disease syndrome. You might hear about this on the radio. This is why they're trying to get ventilators to all these states. The problem is it's not a typical acute respiratory disease syndrome, okay? And what they're finding is that actually, when you put someone on a ventilator, it's a very poor prognosis. And so what they're finding in some of the medical centers around the country, they're putting people on the ventilators as late as they can, because they're finding that there's a better response if they just have people lay on their stomach in what's called a prone position. Once they put them on a ventilator, it does not look very good. Now, the cytokine storm, again, it's something, if you follow the natural news much, they're finding that a lot of people that are dying are actually dying of the cytokine storm. Cytokine storm is, if we go up our pictures with how the immune system kicks in, it actually overreacts. We have inflammation that goes a little haywire. What happens is the inflammation increases to a point that it actually works at killing the person, okay? You might have heard things that people were saying that's why you should not, let someone else in here, that's why we should not be taking elderberry. Well, the studies really disprove that. Elderberry, for example, only increases the response rate by about 1/2 to 3. When someone's in a cytokine storm, it's like 6,000. So it's a process which this inflammation goes into a full bore, and once that happens, the body deteriorates very, very quickly. Okay, now let's talk about nutrition a little bit. The clean anti-inflammatory diet is very, very important. One thing is known is as we cut calories, our body becomes healthier, okay? Over the years, the number one thing for increasing life expectancy is cutting calories. If you can cut your calories by about 1/3, you will definitely live longer, okay? Hard for a lot of people, but that's one thing, especially when there is a pandemic like this, that something you might consider. The healthier we are, of course, the better. Low glycemic foods, especially low glycemic fruits, vegetables, very, very important. You can go on the internet and look at, just Google low glycemic foods and you'll get a list of them. These are foods that have very little sugar or that are, when the process, convert to small amounts of sugar. The keto diet has been very, very popular lately, last number of years. In this kind of situation, it can be good. There's no one diet that works for all people, but the keto, we're increasing fats, decreasing carbs, and some of the preliminary research is showing that it can work out good for a while. Some people should not be on it for too many months, and some people do very well being on it for their entire longevity. But it's something you might want to consider. The big thing is keep those sugars down. Very, very important. Many people nowadays have gut issues. It might be IBS. It might be Crohn's disease. It might be SIBO. There's multiple gut issues. We remember your gut and your brain work hand in hand. And so your gut needs to function. Also realize 70 to 90% of your immune system occurs in your gut. So we need to keep that gut functioning as good as possible. If you do have a gut issue and you're on supplementation, very important you keep that up. It's also a good reason, since so many people are at home now, the junk food diets have gone up. For the first couple of weeks, people were eating much healthier. Now they're going back to a lot of junk food. And so we really want to keep that junk food down. We want our gut to be functioning optimal. It's going to help our immune system and in the long run help hopefully prevent the COVID-19 from taking over. Reduce toxic exposure. There's many ways of doing this. Of course, some of them are, not drinking out of non-PBA plastics. Watch the plastics very carefully that you store food in, that you drink out of. Toxins in the air. Of course, you don't want to be around people smoking. You want to. We don't have the problem here that they do in China with the air pollution. But again, any of the toxins for women, that might have to do with look at your cosmetics and find out. Read the ingredient list very well. There's a lot of toxins that are in many of the cosmetics out there. Okay, with men working around stuff in the shop. Solvents, paint thinners, etc. Now's the time not to be doing that stuff. Just hold off, wait a couple months, then you can work on those projects. Sufficient nutrients, probably one of the most important things. It's been said that we really don't need to have supplementation in our body. All we need to do is eat right. And I totally agree with that. However, it's very, very difficult to get good food. Unless you are raising your own, and you are rotating the crops like we're supposed to. And I say raising organic, it's almost impossible to get the nutrients that we need. So most everybody needs to supplement in some way, depending upon what their tests show that they are lacking. And of course, we want to have 50% of our body weight in water a day. That's very difficult for a lot of people, but it's extremely important. I find that if you can start in the morning and drink at least half of that by lunchtime, that's a great way to get started. Many complaints by patients, they're trying to down too much water at night after supper, and then they're getting up multiple times to use the restroom at night, affecting their sleep. So you want to finish most all your water by supper time. If you need a little bit more afterwards, that's fine, but don't wait until the after supper time to try to get most of your water in. It does not work very well. Now I want to read this. It says, I do not have a doctor-patient relationship with you on this webinar. I am not prescribing any treatment for your specific circumstance. The information presented is based on the best data and prior research. Because this is a novel virus, there has not been enough time to study any of the current treatments, either pharmaceutical or natural-based. So we need to utilize therapeutic approaches based on past research. I encourage you to stay away from the low information products and stick with the natural products that have good data to back up their use. You might say, what's low information products? These would be ideas that your neighbor comes over, and of course they're staying 6 feet away, and we want to be kind to them, but listen to them. But they say, well, my friend told me to do this, or what we see a lot now also is that essential oils are very, very popular. They can be used very effectively for a lot of things. They're not going to be the best to be focusing as a primary therapeutic form in this situation for COVID-19. Okay, so we want to be taking stuff that has lots of good data backup, even though, as this disclaimer says, that really none of the treatments have been tested with COVID because it is so new. So with that understanding, okay, vitamin C, this is for people over the age of 50 that are really in very good health. Okay, they exercise, they eat well, they have very, very little stress. They're in really good health. They don't have chronic diseases. A lot of them have been blessed by having good genes, and others have just done really good things to keep their bodies functioning well. So for those, and I commend you, vitamin C, 500 to 1,000 milligrams, 3 to 4 times a day. Again, these are preventative. Once COVID's done, then we can scale back to a more realistic or a normal amount. Vitamin D, 5,000 to 10,000 IUs per day. The only way I'd say take less than this is if you had a recent vitamin D test and your level is at least 50. Okay. Now, being in Montana, used to be in Ohio, I got patients from all over. Those on the northern end of the upper part of the United States, in the winter, we literally cannot get vitamin D. It has to be through supplementation. The sun is not up high enough that it's going to allow synthesis in our skin for the vitamin D. Even if you stand behind windows, most all the windows are low E glass now, and so they filter out the radiation. And if you are outside, then how many people have much skin exposed? Now, people closer to the equator, it's a different situation. Their vitamin D levels might be up high enough. So let's say if you know what your vitamin D level is, great. If it's 50 or higher, whatever you're doing, keep that up. If you've not had a vitamin D test run in the last 6 months, then I would highly encourage you to pick up the vitamin D and start taking it. Now, the next one is very interesting. Research came out this last week showing how important melatonin is. Now, melatonin, most people think about it as being a sleep aid at night, and it works very good for that for many people. I will mention that there are some people that do not do well with melatonin, and it actually keeps them awake. And so for those, you want to take the melatonin earlier in the day. Those of you that it does not bother, I encourage you to take it at night because it just helps you sleep a little bit better. Melatonin, they believe, is maybe one of the reasons why we're seeing the death rate in the older population and not the younger population. Melatonin drops off significantly in the 40s. And the melatonin also addresses a cleavage point on the virus, which they believe is the secondary reason why, or excuse me, the primary reason why the melatonin could have a very significant impact. 3 milligrams is all that you really need. Again, in the preventative thing. Some of the medical centers, they're using high doses of melatonin as people start becoming symptomatic. And what we're finding is that I'm watching a lot of the medical centers around the country, they are starting to put in significant amounts of nutrition with their pharmaceuticals because they're finding that the straight pharmaceuticals are not making the changes that they want. So quite interesting. Okay. And this here, this explains a little bit about the how melatonin works. So we have melatonin is going to affect some of the inflammation markers up here, the reactive oxygen species. It decreases the oxidative stress, which is very, very important in this, and then also works for sedation. So when people are in the hospital, they're putting them on upwards of 20 to 40 milligrams of melatonin to let them sleep better, but also to affect these two other areas. And very, very new information. Okay. Now, if someone does not have a good diet, they also need to be on a multivitamin. And no gummies. Gummies are not allowed for adults, and they shouldn't be allowed for kids either. The multivitamin will maintain a certain level of micronutrients, and the body works synergistically. So that what that means is that every part works with another part. And so if we don't have the base level of vitamins and minerals, these reactions, these enzymatic reactions will not take place the way they're supposed to. So for many of these micronutrients, we don't have to have large amounts, but we just have to have enough amounts to work at allowing these reactions to go forward. So that's why a person that does not have a good diet definitely should be on a good multivitamin. And we talk about good vitamins, you don't want to be buying those at the box stores because many of those do not have in them what the label actually says they have on them. So you want to be getting the pharmaceutical grade or the professional grade nutraceuticals. The next one is also some articles showing up this week showing very, very effectiveness. There are sulforanes, and these are the chemical compounds that are found in many of the cruciferous vegetables and kale. One of the most effective things people can eat is the broccoli sprouts. Okay, and what they do is these sulforanes, they regulate the genes that affect virus reproduction. So you're actually decreasing the rate at which the virus is reproducing. And I didn't want to put down brand names because there are several several manufacturers that make this, you can just eat a lot of vegetable, broccoli and cauliflower and cabbage and kale, or you can get these sulforanes. And that's something that's just come up very, very recently, and they're showing to be quite effective. Zinc, I've heard about this for quite a while. This has to do with a lot of cellular processes. It works with, especially with the viruses reproducing. Quercetin, we talked about this one last week. This inhibits the heat shock proteins, especially important if someone starts moving into that next phase. So we're going to have a bunch of them listed here. We really can't tell you which ones to take. These are all that the data is showing quite effectiveness. The sulforanes, for example, in some of the rabbit studies they've done, decreased it by 50%. The rabbits going into acute respiratory distress. And they're showing, as they're utilizing this on patients now, that they're getting better results in some of the medical centers. Elderberry, I mentioned this before. Certain people are concerned about the cytokine storm. We don't need to be. Elderberry is very, very good as a general antiviral. A lot of people make their own. Our daughter-in-law makes it in Washington. And you can make it, you can buy it, but you don't have to be worried about the cytokine storm. Now, if someone has to move to the next phase and they're in medical triage, then they definitely pull that one away, and hopefully you'd be in a facility that understands critical care and nutrition, and they would integrate these protocols that are being integrated in a lot of these other medical facilities around the country. Probiotics, pretty much everybody knows probiotics. Basically, it's the bacteria in our gut, again, supporting 70 to 90% of the immune function of our bodies. If you have a good variety of foods, many people don't need to have them. Some people, because of their genetic makeup, need to be having probiotics more than others. Prebiotics are actually important also. Prebiotics, you cannot take them because they die in the presence of oxygen, but prebiotics are basically fiber. And so you eat the fiber. The fiber is a growing grounds for prebiotics. So prebiotics and probiotics are important. If you can only take one, go for the probiotics. Nanosilver, this has been shown to be very effective for killing viruses. Again, not specifically the COVID-19, but other viruses, other coronaviruses. It can be done orally. It can be used as a disinfectant to wipe counters down. In fact, the CDC, in some of the publications, recommend that. This is not the colloidal silver that can turn people blue if people drink way too much of it. It is a very, very small particles. That's why I call it nano. They've done nano gold and nano silver. Nano silver is cheaper. These particles are so small, they attach to the red blood cell, circulates throughout the body, and then at that 90 to 120 days, when that blood cell gets killed off, it's excreted. Okay? Specialized herbs. There are many others. There's skullcap that goes, the list can go on and on, that work specifically for certain kinds of people. Also, if you are on certain medications, some of these are going to be better than others. So there are contraindications, and that's why we can't make just general rules other than the vitamin C, vitamin D, and melatonin. These work pretty much for anybody. But when we get into some of these others, it's very, very specialized based on your history, what kind of chronic conditions you might have, and then other factors as well, especially if you had any blood tests in the past. Okay. So besides nutrition, in the supplementation, adequate sleep, very, very important. We need to get at least that 7-8 hours of sleep. If you start feeling run down, get more sleep. Okay, there's not a whole lot to do right now, so get that sleep that you need. Exercise doesn't make any difference. If it's aerobic, if it's resistance, whatever it is, you just need to be getting exercise, hopefully on a daily basis. Okay, exercise makes the body stronger, and anything we do that increases the strength of our body is going to decrease the likelihood of a virus, bacteria, etc., entering our body, or not. Because take it back, they're entering our body all the time, but being able to take over. We want our host tissue to be stronger. Stress is becoming a huge problem right now. And so I encourage you to find de-stressing activities, okay? And I know I get through Instagram and other places get ideas every day. You're probably getting inundated also with them. If you don't like any that you see, come up with some of your own, okay? Our faith, very, very important, that spiritual connection with God, okay? And if someone would like some information on that, just email me, and I'll be glad to send you some information that can help you with your journey. But anytime there is a significant stress in someone's life, that spiritual connection, their spiritual faith, is probably the most important thing to pull them through. Another thing, learning something new every day, okay? People are getting bored, okay? This is a great time to learn something new, okay? We're in an era that you can learn just about anything, okay, on the internet now, okay? Or read a book, but do something new, learn something new every day. And before you go to bed, think about, what did I learn today? And hopefully more than one thing, but at least one thing. Okay? We want to connect with your fellow human beings. Okay? A lot of people are struggling with this. Some people are much more engaging than others. Those of us that are more introverts are doing fine. Extroverts are the ones struggling more. So we have the phone, your email, video meetings. And I know that Zoom has recently had some issues with their security. We updated for this. And actually, I use Zoom in my practice, but it's a encrypted, secure site. So there's never an issue there when I see patients individually. Send a letter to someone. It's a lost art, okay? And you probably really surprise somebody if they got a letter, okay? Or send pictures with a note. Come up with whatever is effective that you enjoy doing so you can be a blessing to somebody else. Okay, many people struggle with mental health. The self-isolation can increase panic attacks, depression, despair, grief, self-harm, toxic relationships, domestic abuse, and loneliness. Very, very sad, but so many people struggle with these, especially in our youth. They say that about 20% of the young people struggle with depression and some of these other issues. So if you know anybody that is in this category, try to reach out to them. Okay, they're going to need some extra help during this time. And when we come out of this, it's not going to be like flipping a light switch and go back to normal. It takes some time. Okay? Now, I'd like to talk about the human genome. Okay, because there's more and more literature coming on the last week or so. Say, our genetic makeup, is this making a difference? Okay, it's interesting. Like in Germany, their death rate is quite low compared to the number of cases they have. Italy's different story, Spain's different story. So as this is mapped out differently, it'll be interesting what the outcome is. We have about 26,000 genes in our human genome. They thought we had hundreds of thousands of genes, but when they finished the Human Genome Project, we have about 26,000 genes. That means 91% of all human genetic code is identical. So for you and me, 91% of us is exactly the same. It's at 9% that makes us different, okay? Now, the important thing is your individual variation contributes to both your disease susceptibility and therapeutic response. That's why there are people that have heard on the radio today, a lady that had she was taking anti-rejection drugs. She had a kidney transplant. She had a fever for one day and she was fine, developed the antibodies. Genetics has so much to do with how we respond to any kind of disease. Our genetics are never going to change in a lifetime. How we are, our genetic code will be that way from when we're born until we die. The really cool thing is the epigenetics part, because epigenetics takes that gene that maybe not working quite the way it's supposed to, and we can do environmental things, a diet, exercise, stress response, etc., and change the outcome on how that gene works. Okay, we all have errors in our genetic code. Okay, many, many of them. And now there is testing available that shows us how to do this. And for example, we take, it's a very simple test. You take a swab, a cheek swab, and it's sent to a lab. and we get about 900,000 what's called genetic SNPs off of it. Well, not all of those are important. What has been mapped out is about 6,000 genes, 6,000 genetic SNPs. And there's been a great deal of research on this. And for example, see these two mice, okay? They are identical twins. They're called agouti mice. The one on the left, the larger one, they are bred to be like that. They are all genetically the same. They're bred for research. They are bred for a high cholesterol, overweight, brown fur, and that's how they normally turn out. So what they do is they take two of them, and this has been repeated many times. They'll take two at birth, separate them. The one on the left, they just do what they would normally do. The one on the right, the little brown one, they feed him food that's really good for a mouse. They put him in an individual cage. They put an exercise wheel. They have the lights on during the day and off during the night. And they do this stuff so it's a less stress situation. Again, good food, exercise, etc. When they grow up, this is how they are. They are identical twins. Okay? And this is because their genetic code is the same, but the epigenetics, the environment, dictates how those genes are expressed. And this is the really cool part about being able to look at someone's genetic code now and then tell them what they need to do as far as nutrition goes, as far as if they're on medications. When we work with their medical doctors, certain medications respond too well for someone. Some are contraindicated because of other diseases that may show up. And so it is not just a test to use to show what disease you might have. In fact, we ask patients, do you want to know if there's something significant that shows up? And most people say yes, but that always is an option. We're looking more physiologically, how can your body function at its optimum? And every day there is the National Institute of Health is coming up with more and more studies that are being put in the database. We slice and dice the information in so many different ways with artificial intelligence. And it's really quite amazing what can be shown now. Okay. So going forward, okay, again, the COVID-19 will come to an end. In Montana here, they say that the peak should be around the 26th of the month. I know several people logging in Ohio, that's around the 19th of the month. Some of the southern states are going to be longer. It's going to end, okay, just like flu does. And I just looked the other day at I think there's been 28,000 people die of the flu this year, but we don't hear about that. Okay? So life's going to go on. We will return to whatever's going to be normal at some point. Okay? Times like this help us understand the importance of optimal health. The sad thing is that when this is all over, there's a lot of people just going back to what they did before. Okay? The key is we're going to have new viruses, new bacteria, resurgence of old pathogens pretty much every year. Okay? Our world is becoming smaller. There's more and more travel, et cetera. The most important thing we can do is keep our bodies healthy. If we do this, we can really pretty much withstand an awful lot that's going to be coming our way. Either our host tissue is going to be stronger or it's going to be weaker than the pathogen. If it's stronger, it's going to kill it off. We're going to develop immunity and we're fine. Once we have immunity to that organism, then when it comes around next time, what happens is those B white blood cells, they are going to tell the other white blood cells to go and attack. Okay, so they're going to know exactly what to do. They know what it is because they've read the book, they have the code on it, and so we're not going to go into the same thing for COVID-19 again. And that's why each year when we have the influenza, there's different strains. And so they try to pick out the 3 strains from Asia in the spring that are going to affect us in the winter. Okay, and that's what the inoculations are. Unfortunately, a lot of times they're just not effective. So I believe it's more important to keep our bodies healthy so that they can respond to pretty much any kind of pathogen that comes our way. Again, I do have a great concern for those people that are not in good health. You really need to stay away from people. I don't care really who it is at this point. But we want that for those that are healthy, stay healthy. If you're not as healthy as you want to be, then let's help get you to that point where you are healthy, because everybody can improve their health. And we want everybody to live optimally.